We've all had a toothache, right? That throbbing pain that just takes over everything. But what if that simple cavity, if you just ignore it, could actually turn into a serious infection, one that starts eating away at your jawbone? It sounds intense, I know, but it's a real condition called osteomyelitis. So let's get into how this happens. Right. This is the big question. How do we get from point A, a common cavity, to point B, a gnarly bone infection? It's basically a chain reaction, a domino effect where one small problem kicks off a much, much bigger one. So let's trace the steps. So first things first, what exactly is osteomyelitis? Well, it's an infection of the bone itself, and crucially, the bone marrow inside. Now, it can happen anywhere in the body, but it's surprisingly common in the jaw, especially the lower jaw. And the number one cause? You guessed it, an infection that starts in a tooth. All right, let's talk about the origin story. What really kicks this whole dangerous process into gear? More often than not, the whole thing gets started with a problem right there inside your mouth. So you can see here the list of causes. And what's really striking is that top category. I mean, sure, a jaw fracture or other issues can cause it, but most of the time it comes directly from the tooth. We're talking about a cavity that gets ignored, becomes an abscess, or maybe a really bad gum infection. Basically, the bacteria find a way in, and once they're in, they set up camp right inside the bone. Now, of course, not every person with a cavity gets this. Certain things can really stack the deck against you. If your immune system is already working overtime because of another condition like diabetes, for example, it's kind of like leaving the front door unlocked for an infection. And things like poor oral hygiene or smoking just create the perfect environment for these bad guy bacteria to thrive. Okay, so the bacteria are officially in the bone. Now what? This is the really critical part of the story. This isn't just an infection sitting on the bone, it's a battle happening inside the bone that threatens its very survival. And this is the domino effect in action. So think of your jawbone like a busy city with a whole network of pipes. Those are your blood vessels, keeping everything alive. When the infection gets in, your body's natural defense is inflammation. But inside a hard, rigid bone, that swelling has nowhere to go. It starts to squeeze and crush those tiny blood vessels, cutting off the blood supply. And just like a city without water, the bone tissue starts to starve and die. This process is called necrosis. And what happens to that dead bone? It becomes something called a sequestrum. It's basically this little island of dead bone that breaks away from the healthy part. Now, this isn't just a piece of dead tissue. It's a perfect hiding spot, a fortress for bacteria, which makes it incredibly hard for your body, or even antibiotics, to clear the infection out. But your body is a fighter. It doesn't just sit there. It tries to wall off the problem by building a shell of new bone around the infected area. The shell is called an involucrum. It's a pretty amazing defense mechanism, but the problem is it can trap that dead, infected sequestrum inside, letting the infection just keep simmering away. So how would you even know if you have this? Well, the infection can show up in two main ways. You can think of it as a really fast, aggressive fire versus a slow, smoldering one. Okay, so the acute phase is the fast burn. It hits you hard and fast with severe pain, fever, swelling, pus, all the classic signs of a really angry infection. The chronic phase, that's the slow smolder. It's a bit sneakier. The pain might be milder, or it might come and go. You might even notice a little tunnel to the skin that drains pus, or see the bone itself exposed in your mouth. And, of course, that sequestrum is the hallmark of a chronic infection. To figure out what's really going on, doctors have a few tools in their belt. Blood tests can show the classic signs of infection and inflammation. They can take a sample to culture the bacteria and see exactly what they're dealing with. But the real evidence, the smoking gun, usually comes from imaging. And this is just such a perfect, if unsettling, description. In the very early stages, an X-ray might not show anything. But as the infection continues and literally destroys parts of the bone, it starts to look patchy and ragged, almost like it's been eaten by moths. It's a pretty stark visual of just how much damage this can do. Okay, so we know what it is. We know how it works. Now, how do we stop it? And even more importantly, how do we make sure it never even gets started? Tackling osteomyelitis requires a full-on, two-pronged attack. On the medical side, you've got aggressive, high-dose antibiotics to kill the infection.
But that's not enough, because remember that sequestrum, that dead bone fortress? Antibiotics can't get in there. That's why surgery is absolutely critical. A surgeon has to go in, drain any pus, remove the source, which is often the tooth that started it all, and then physically clean out and remove all of that dead, infected bone.
And you really, really don't want to let this go untreated. The jawbone can get so weak that it can literally break from normal use. The infection can spread into the surrounding face and neck tissues, that's called cellulitis, or worst case scenario, it can get into your bloodstream and cause sepsis, which is a life-threatening emergency. At the end of the day, it really just comes down to this. For all the complex treatments we have, simply preventing the problem in the first place is so much easier. And here's how you do it. This is the key takeaway. The absolute best way to stop this whole cascade is to get dental problems treated early. Don't put off dealing with a cavity. That, plus just good, solid, everyday oral hygiene, that's your best defense. That's how you make sure that first domino never, ever falls. And I want to give a quick shout out to our source for this explainer. All this great information comes from the revision materials at Durkat Femium Revisions. They're an amazing resource if you're a medical or dental student trying to get your head around complex topics like this one. So, to wrap it all up, the path from a simple toothache to a destructive bone infection is a very real one. But the good news is, it's also a very preventable one. At every single stage of this process, the most important thing is simply taking action early. So, we've seen this whole chain of events, right? From a tiny spot on a tooth all the way to a serious bone-destroying infection. It really makes you think, what small problem are you putting off? Knowing what you know now, what's one simple change, one small thing you can do for your oral health today to make sure this particular chain reaction never gets a chance to start?